Hi, I'm Dr. Siegfried, leading expert in the bilateral nasal specific technique, having studied with Dr. Stober, who was a developer in the Northwest. I spent over 1,000 hours with him, 10 years at his side, watching him, discussing cases. And today, one of the cases we're going to discuss is of a child he's now 8 months old, but he came to see me after he was about 4 or 5 months old. And the reason that the parents brought him to me was because his head was kind of stuck like this, and he'd had a couple chiropractic adjustments, but he wasn't able to hold his head up. And interestingly enough, he had a very quick delivery, no problems. The mother wasn't induced. He just came out real quick, but his head and his neck got jammed. And so he was having a hard time with his balance of his head. So he was kind of like this. And interestingly enough, this is how Dr. Stober got started with children who had been injured at birth. Now, I'm not saying this guy was injured. I think his head was just jammed up and his upper cervical spine was pinched. But in any case, the parents came to see me with him. And the idea here is to generate full power from the brain, from the top down, inside out. And so when we adjust the head using the bilateral nasal specific technique, we open up these we take the brakes off, so to speak, take the brakes off the 22 bones of the head, get the primary respiratory mechanism pumping the way it should, like this. And what we're after is full power. That's what we're after, full power. And when we get the full power, things start happening. And in this case, this little guy, after his first treatment, he started to bob his head up and back. Of course, the parents were thrilled about that, but they took a couple treatments, and then they live in Canada, so they left, and then they're back again, and I'm treating him again, and he's also had some regular adjustments on his neck up there, and that has helped, but he's still, the balance is not quite there. And since I saw him the other day, I've given him 2 treatments now within the past week. And now I think he's 8 or 10 months, something like that. He's grabbing onto things and trying to walk. So obviously his balance has improved. The parents are thrilled. Not to mention the fact that you could see his head expanding with the treatment. So everybody's happy. And what I wanted to talk about is this. Children's heads are very pliable. They're very delicate. And you have to be very precise with your placement of the finger cot and inflation of the finger cot and release of the finger cot. So it gets set, you inflate it just a little bit, you deflate it, and then you take it out. And in this case, what I did was I used one finger cot on top of the blood pressure bulb, and because his nose is so small, and he's just small. So the point is, what I do is I take one finger cot, put it on the edge of the blood pressure bulb. In this case, this is opened up about 5 lengths, but actually in an infant, it might even be less. You have to kind of judge the size of the finger cot to the size of the nose that you're working on. So in this case, I'm just making the point that I open this up. I'm opening this up, but I also use one finger cot to do the treatment. And the thing that's interesting to me with this baby, because his head is tight, different parts of it are tight. So the point I want to make here is, number one, the placement is absolutely important. So you get it back into the nasopharynx, and then the next thing is you give it just a little inflation, enough to trip the latch, so to speak, back in here, which is what Dr. Stober used to say. You want to trip the latch of the sphenoid bone. You trip the latch, and it just creates movement, and that's what we want. And then again, you go to the other side, bottom floor. You just got to make sure that you get the proper placement. And then you make the slight inflation. You want to make sure that the cavern, the meatus, is full, and then you want to have this effect. Maybe not that big, but you'll know that you've gotten the release because you can feel it. It just goes through want of a better description, you can feel the release. And some worst case scenario, if it inflates too much and it ends up in the back of the throat, then what you do, which is the way they used to do it years ago anyway, they'd inflate it so much that it would be in the back of the throat and you might see the balloon in the mouth. You can take a paper clip and just pop the balloon and then they'll release it that way. But then you have to reload, then you have to reload the finger cod, etc. But if you do it like I'm saying, you get it placed properly, give it a little bit of an inflation to set it, and then inflate it, trip the latch, take it out, and then you go to the next one, the next floor. So again, there's a bottom floor on each side of the septum, middle floor on each side of the septum, top floor on each side of the septum, and then we do the bottom floor on each side of the septum. That's the way it was developed, taught, and practiced for over 35 years. When I met Dr. Stober, I've been doing it since 1976, and that's how I do it. And that's how we get our best results. Having said that, you can also see the temporal areas will quote unquote flare a little bit as this opens up. So that's another thing you're looking for. Now, the other thing is with these little guys, they don't like the treatment, obviously, and they're squirming as much as they can. So what I do is I literally have the mother or the father or the parent, this is the position on the table, and they hold their arms like this. And then they'll take their hand and just kind of hold them so that they can't be flopping around. And of course their head's going to be going like this because they're trying to get away. So what we do, we have the parents like this, and then we have them straddle the pelvis, and then I take care of the head, and the head's maybe moving, and then I have to stabilize the head to make the treatment. Now, some people think that's pretty brutal, but I can tell you something. In all the years that I've been doing this, these children, they squawk at first, but after a few treatments, they intuitively know that it's good for them, and I'm not hurting them. So they'll just lay here, and it's uncomfortable, and they might cry a little bit, but they let me do the treatment. That's how I know that they know that I'm not hurting them. Also, that it's good for them, and they just relax, and they're a little uncomfortable. So there's that aspect as well. So I just wanted to make the point that when you're treating with children, when you're treating children, you have to make sure, it depends. And then after maybe after a year, maybe it just depends how much space they have. Then we will go to another finger cod on top of the inner tube, this is the inner tube as we call it. But initially, you want to make sure that it's placed properly back into the nasopharynx, and it's a tremendous dexterity thing to make sure that you get it placed there, and then you inflate it just a little bit to make sure that it's set, and then make the other inflation to make sure that it's going to release. Is it the same every single time? I'm not going to sit here and tell you to pump 1 or 2 or 3 or 4 times. I'm going to tell you this. I'm sitting here telling you you want to set it, and then you want to get it back. You make sure you place it properly, and then you set it, and then you have to make the inflation. Now sometimes it might take 1 or 2 pumps. It just depends. But when you feel it release, then you take it out and continue. So thanks for watching. If you have any questions, you can always go to my website, OregonWellnessCare.com, to the nasal specific section. Call me at 503-472-6550. Happy to help, and thanks for watching.